Mpox has been reported in the Democratic Republic of the Congo for more than a decade, and the number of cases reported each year has increased steadily over that period. Last year, reported cases increased significantly, and already the number of cases reported so far this year has exceeded last year's total.
The world is once again on the brink of a public health crisis. A silent but deadly virus is spreading from the heart of Africa, threatening to cross borders and impact millions. Mpox, also known as monkeypox, has resurfaced, but this time it's different. On August 14, 2024, the World Health Organization, WHO, declared this outbreak a public health emergency of international concern. Why? Because the virus has evolved. It's more lethal, more transmissible, and it's already causing devastation. What exactly is happening, and why should we all be concerned? In this video, we'll break down the facts, the science, and what you need to know to stay safe. Mpox was first identified in the 1970s in the Democratic Republic of Congo, but the virus we're dealing with today is not the same. This new strain, named Clade Ib, is more dangerous. It's a mutation of the original virus, with a much higher fatality rate, currently estimated at around 3.6%. This strain is primarily spreading through sexual contact, but what's alarming is that it's not just confined to adults. Children are also being affected, and the consequences are severe. The outbreak started in Central Africa, but experts warn that it's only a matter of time before it spreads beyond the continent if left unchecked. Why the WHO declared a global health emergency? The World Health Organization's declaration of a public health emergency is a serious step, one that's not taken lightly. This decision reflects the rapid and uncontrolled spread of Mpox in the Democratic Republic of Congo and surrounding countries like Burundi, Kenya, Rwanda, and Uganda. The WHO's warning is clear. This virus has the potential to spread globally, and we must act now to prevent a pandemic. The international community is being called upon to provide support, resources, and most importantly, vaccines to the affected regions, symptoms, transmission, and vulnerable populations. Mpox symptoms can be severe and include high fever, intense muscle aches, and large painful pustules that cover the body. These pustules can leave permanent scars and in some cases lead to life-threatening complications. The virus is highly contagious and spreads not only through direct contact with infected lesions, but also through respiratory droplets during prolonged face-to-face contact. Children and immunocompromised individuals are particularly vulnerable to severe outcomes, making it crucial to identify and isolate cases quickly. Current vaccine efforts and challenges. Vaccination is our most effective tool in combating Mpox, but there are significant challenges. While vaccines do exist, their supply is extremely limited, especially in the regions most affected by the outbreak. The WHO is working alongside the Africa CDC and international partners to accelerate the distribution of vaccines. However, the logistics of getting these vaccines to remote and under-resourced areas are complex. The current plan includes the distribution of 200,000 vaccine doses, but with millions at risk, this is just a drop in the ocean. More needs to be done, and fast. This outbreak is a stark reminder of how interconnected our world is. A virus that starts in a remote part of the world can quickly become a global threat. The World Health Organization's warnings should not be ignored. We all have a role to play in spreading awareness and supporting efforts to control this outbreak. Stay informed, share this information, and help others understand the seriousness of the situation. By working together, we can prevent this virus from causing further harm. Make sure to subscribe and turn on notifications to stay updated on the latest developments. Your health and the health of those around you depend on it.